that in the numbers. So here I am counting it in the numbers. So in anatomy, one image of hand was given and they are pointing towards the carpal and metacarpal joints of hand, and the answer for that one is the saddle joint, and this is the confirmed answer. So here the answer is saddle joint. Okay. Now the second question, an anencephaly image was given and asked about the closure date. So for this question, there was four options were there: failure of closure of cranial neuropole, caudal neuropole, and at 3 weeks and 4 weeks. These were the options, four options, and out of it, the answer correct one is the cranial neuropole at week 4. They did not mark the failure of closure of neuropore at week 3 because there it doesn't mention the cranial neuropore. And even I don't remember which option I marked in the exam. So this one is like I also counted like I did not count the mark for this question. Okay. Now for the third question, actually what happens now? So we are now after a week, I'm preparing these questions. So all like 50% I also forget like what is written in the questions. So here the patient was having stroke, unable to speak fluently, and but he understands properly, but he was unable to speak fluently. So for that, if question was unable to speak fluently, then answer is Broca's aphasia. And if in the question paper it is speak fluently mention is there, like the person can speak fluently, but there is understanding problem is like that, then the answer is Wernicke's. So for that, according to you, if you remember that what was given in the questions, then you can mark according to yours, okay? And you can count the point also. Now for the fourth question, common carotid artery pulse, like what is the at what level we can measure the common carotid artery pulse? This was the question, and the correct answer for this is cricoid cartilage. So cricoid cartilage is the correct answer where we can measure the common carotid artery pulse. Now for the fifth question, epidural anesthesia was given and the structure is not punctured. So here, which structure we did not puncture during epidural anesthesia? The answer is arachnoid method. All other structures we have to puncture. Okay. For the sixth question, arrow marked was given, and the option is that which which part of the heart it is. So they marked it from the left atrium. So for that image, the answer was left atrium. Remember, it's 100% confirmed the image is of left atrium because this question after the exam, I myself checked on Google and the answer was confirmed. Okay. Now for the seventh question, hand image at medial border of snuff box. They mark the arrow towards the medial border of the snuff box. Please remember because for these questions I watched so many faculty videos and they marked like lateral border of the snuff box and they said that it was APL, but that was not the correct answer because they marked towards the medial border of the snuff box and the correct answer for this is EPL. Okay. Now for the eighth question, tendon marked is image is given at the forearm side, and for that the correct answer is flexor carpi radialis. So flexor carpi radialis is the correct answer for that. Now for the ninth question, they give the image of the omphalocele and we have to identify that. So for that, the image, the correct answer is omphalocele, and for other one, the correct answer is gastroschisis. Now for the 11th question, conjoint tendon, except they ask. So like all the options were about the conjoint tendons and we have to tell the which one is the not the correct answer for that. And for that the answer is that conjoint tendon runs parallel to inguinal ligament. This one is the incorrect option. So you have to mark this option there. Okay. Now the next question was marked line at vertebra level. Okay, for this marked line, they gave us one figure, and there they marked like almost this type of figure was there, and in which here is the umbilical, and they marked above the umbilical like this area. Okay, and we have to identify that whether it is T12, L1, L2, and L3. These four were the options there, and some teachers said that it is L3, and some said it is L2. So this question was like not up to the mark like which one is the correct answer. Even I am also confused like whether it's my correct or wrong. Now, so mostly they marked L3. Mostly the teacher said it's L3, but I marked L2, so maybe mine was wrong. Okay. Now for the 13th question, lesser trochanter in the. So let's continue. In the question number 13, the arrow image was given, and in that image, like one diagram was given, and in which they mention they put the arrow mark on lesser trochanter, and they ask about like which muscles get attached to there, and the answer for that one is iliopsoas muscles, and this one is also the confirmed answer. Okay. Now for the 14th question, the image was given and we have to identify that which structures were there, and we can easily identify that those were the liver, pancreas and the spleen. Now for the biochem question number 15, tyrosine transaminase causes asked in the question, and for that the answer is type 2 tyrosinemia. For that one the answer is type 2 tyrosinemia. Now for the 16th question, Pitake joint pain will be there, and for that the vitamin C deficiency will be there. And whenever we see the necklace and cheilitis, we always used to mark niacin deficiency. So for this one also, the niacin deficiency, the vitamin C and type 2 tyrosinemia is the answer. Because here I put one mistake that I marked there type 1 tyrosinemia, that was, mine was wrong. But the correct answer is type 2 tyrosinemia. Now, for the 16th questions, Pitake joint pain, vitamin C is their necklace for niacin deficiency, and for the 18th question, precursor for niacin is the tryptophan. We already know this 100 times we marked in our GT and questions. Now, for the next question, there was increase of TIBC when I was because I almost see so many teachers recall questions and they put like decreased TIBC, but in the question paper it was not decreased, it was increased. That's why the answer is iron deficiency anemia. Okay. Now for the 20th question, iron absorption is decreased by T, which everyone marked correct. Now for the 21 question, xerothemia was mentioned in the question, and for that the answer is vitamin A. For the 22 question, lactulose will be there, and lactulose is made by galactose and fructose. Galactose and fructose. Now for the purine ring, glycine, aspartate, and glutamine, these three amino acids makes the purine ring. Here the answer is glutamine or the glutamate, because in the question options the glutamate was there. So please see that whether you marked it glutamine or glutamate. Okay. Now for the ammonia from brain to liver transport is by glutamine. Heme derived from glycine. This is also the question. Now for the receptor play role in skeletal muscles for glucose uptake, and for that the correct answer is GLUT4. Rate limiting enzyme for cholesterol synthesis is HMG-CoA reductase. Rate limiting enzyme for HMP shunt is G6PD dehydrogenase. Mitochondrial matrix enzyme is citrate synthase, not the MAO and some other options. The correct answer is citrate synthase. And for this question, it's very like difficult to say like which one is the correct answer, because every teacher, some teachers say it's GTT CCCA, but one of the prep lady teachers said the answer is ACC TTG. So I'm not counting for this my marks, but hope for the best. Now for the 31st question, triple helix structure is seen in which catalase, elastase or collagen. So for this, I don't know the answer because I didn't remember the MCQ options also. So that's why I did not put any answer, but I remember the question. That's why I wrote this question. And the 32 question is perichondrium made up of which type of collagen. So for this also, I don't remember the correct answer because I don't know which answer I put, but you can check it on net. Now for the 33rd question, buffering of hemoglobin is due to which amino acid? For buffering of hemoglobin, this answer also I don't know. For the 34th question, vegetarian mother deficient nutrition is there. That is the answer of vitamin B12. And same question was also there in which they asked about the iron deficiency anemia. Okay, these two different questions will be there. Child thick skin is there, ear in hyperpigmentation is there. For this, the correct answer is alkaptol urea. For the physiology, The question number 36, they regulate body temperature. So hypothalamus regulate the blood body temperature. Central vein, which type of cells in the center? So in vein, which type of cells in the center? For this, uh, teacher said RBC is the correct answer, but for me, it's like I marked incorrect in the exam. So for you, you can count the mark. Okay. Now for the 38th question, also the different teacher have different answer. Dynein protein is a some said transport protein and some said molecular motor. So we don't know the correct answer for this question. So I marked it. Now for the 39th question, L-type calcium channel was there, and for this the answer is T tubules. Okay, you can check this question also because I don't remember it like the options that, but in recall I saw this, so I write it. Now for the 40th question, which lymph nodes are Delphi nodes? So which lymph nodes are Delphi lymph nodes? And for that the options were 1 and 2, 3 and 4, 5 or 6. The correct answer is 6. You can check this also because I don't know the correct answer for this one. Now 41 question, person was unable to sleep without medicine. So which thing was there? So overactive reticular formation will be there. Now for the micro and path, 42 question is star formation and there is mite bite. I don't remember whether mite is written in the question, but if mite bite is written in the question and star formation is there, then the correct answer is scrub typhus. Now for the 43rd question, the palm fruit eaten and Kerala history will be there. So for this, the correct answer is Nipah virus. And the reservoir for Kala azar was human. Pet dog multilocular cyst with liver is there. So for this, the correct answer is Echinococcus granulosa because dog is mentioned in the question. Now for the 46th question, Plasmodium species in brain is the answer is Falciparum. Primary identification for CB0 or gene expert is MTB and rifampicin resistance is the correct answer. For the 48th question, I don't remember like whether in the question it is rheumatic fever mentioned or it is infective endocarditis mentioned. But gram-positive cocci chain will be there, and I remember the image also, but I don't remember whether it is a rheumatic fever or an infective endocarditis because on these two factors the answers will be different. If rheumatic fever in the question, then answer is Streptococcus pyogenes, and if infective endocarditis was there, then the correct answer is Streptococcus viridans. Okay. Now for the 49th question, DHR test was abnormal in the question. A big question was there, but in the second last line there was written DHR test was abnormal. So for that, the correct answer is CGD because in CGD only DHR test is abnormal and NBT we have to perform. Okay. For the 50th question, one image was given of the basal cell carcinoma, and there is also one image for farmer lesions on the shoulder will be given. For that, keratin pulse we can see in the question, but not like that much clearly how the teacher used to show us. But the correct answer was for that one is squamous cell carcinoma. Now in question, they ask about the radio-resistant cell of cycle in which the correct answer is S phase. Investigation of choice for CML is reciprocal translocation. Flexner intestine lesion was there, and for that the correct answer is RB. For apoptotic bodies comprised of cytoplasm, intranuclear and organelle. Cytoplasm, intranuclear and organelle. Next include all except, and the one option was given phagocytosis. That one is the correct answer for this because nets don't show phagocytosis. Now for the 57th question, feature of Turner syndrome, the correct answer is webbed neck. For diabetic blood sample, sodium fluoride, we have to collect the blood sample in sodium fluoride, okay? While sodium fluoride, okay? For the 59th question, beta thalassemia start blood transfusion, anxiety, fever, and hypotension. And what is the next step? This was the question. And for that, if the patient during transfusion, the patient start anxiety, fever, hypotension, for that we have to stop the blood transfusion and we have to restart after stabilization. So this one is the correct answer for this option. Okay. Um, for the 60th question, method to prevent febrile, FNHTR for this. Actually, I don't remember this question, but the correct answer for this one is the leukoreduced or leukodepleted. Now for the 61st question, rose gardener disease will be there and sporothrix will be there. So how it will spread? So it will spread by lymphatics. Now for the ABO incompatibility, IgM is the correct answer. Like ABO incompatibility, IgM. Will be there. And in one question, this full form was mentioned in the question. Full form. I don't say that short form may last will be written metabolic encephalopathy, lactic acidosis. These things were mentioned in the question, and for that the correct answer is mitochondrial disease. Now for the 64th question, from here PSM will be started. There was question about the case control study, and the question asked like which one is the true, and lots of options will be there, and in that like options were like effect to cause rare disease and lots of there. But for this, some teachers said some students said there was mentioned not true, but I said like true was mentioned in the case control study, and all statements were incorrect. We have to select the correct one. So effect to cause or rare disease, we have to choose between these. But like I refer Neha Taneja ma'am, and she said like effect to cause is more correct than the rare disease. So for this, the correct answer is effect to cause. Now for the 65th question, sling psychometer image was given and we have to measure air humidity with this. I remember that image was given, but I don't remember they asked about the air humidity or they asked the name of the image. Okay, so I wrote both one, sling psychometer and air humidity. We have to check. Now for the 66th question, Navjat Shishu Suraksha Karyakram is done for newborn. So this one is the correct answer for this. Now for 67, same birth rate but variable death rate is given, and for this the stage 1 and 2 is the correct answer, because in stage 1 and 2 birth rate will be the same but there is death rate is variable. Okay. Now for the 68th question, marriage, mortality and litigation. These phases will be given in the question and we have to check whether it is demographic process or something else. Now for 69th question, HIV is on HIV patient was given and there, he is on ART. Diagnosis TB start on ATT. Dose adjustment they asked. I remember this question and but I put a wrong answer for this. But the correct answer is add dolutegravir 50 milligram in morning. This one is the correct answer, because one option was there that there you should not change the treatment, just continue it. So I marked that one, but the correct answer is add dolutegravir 50 milligram in morning. This one is the correct answer because I marked it in somewhere else also, like in GP or maybe in question bank, but I right now I don't remember. Now for the 17th question, going of legs with bleeding gums will be mentioned in the question. For this, the correct answer is vitamin C. For xerophthalmia, bite or spot, how much percentage? 0.5 percentage will be there. Not part of global hunger index. Infant mortality rate is not the part of global hunger index. Family cycle sequence was given, and I remember that one option was very big, and that one is I think A option was very big, and all others are very small, because in other options they marked like very less out of this. So the correct answer was the bigger one. That is extension. First formation will be there. After that extension will be there. Complete extension, contraction, complete contraction, dissolution, and extension. Now for the 74th question, disaster management cycle, arrange in order. So for this, the arrangement is impact, then response, then rehab, and then mitigation. This is the correct sequence for this. Dispose needle with syringe. We have to dispose needle with syringe in white bin. Okay. Spread of NCD banner, error made, shift from PUFA with trans fat. So spread of NCD banner, error made, shift from PUFA with trans fat. This is the correct answer, because non-communicable disease banner, she has to spread awareness. So she made some titles. So four options were there, and out of which one it was the shift from pupa with transfer. This one is the incorrect, because here she made the error, and this same was asked in the question. Now for the 77 Anmol program for NM is given, and for Anmol we have to check the tablet based software. This is the program for NM, tablet based software. Now for the 78th question, not included under Janani Suraksha Yojana, that is the STD check. We did not check the STD for Janani Shishu Suraksha Yojana. Sorry, Shishu, not Shishu, Janani Suraksha Yojana. We did not check STD. Okay. Now for the 79th question, one image was there, that one is of the linear diagram. For the control mosquito larva, biological method is Cambodia fish. For cholesterol blood scale, we have to check continue, like options were like nominal, ordinal and continuous, and one more option is there. So the, out of those, the correct answer is continuous. Okay. For the GFR, number of live births upon a woman in reproductive age group, this one is the correct statement. And actually, I don't remember the correct way of asking this question, so that's why, but I saw in PSM recall video, so I put it. Now for the sanitation facilities provided for the refugee returning from war, here the correct answer is trench latrine, not the uh, 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 not the other three options. And out of which one, like uh, option was there, but now I don't remember. But the correct answer for this is translatin. Okay. For the reproductive couple, we have to check the TFR, total fertility rate. Median population is denominator in CDR. Median population is denominator in CDR. Serology of IPV, for IPV, the serology type 1, 2, 3. Not included in MMR, death due to RTA, because in maternal mortality rate, we did not check the external factor cause of death of mother. So in external cause, the road traffic accident, we did not count that in MMR. Okay. Now for the nutrition and sanitation program conducted every time. So how the ASHA worker will go and check, like how at how many months. So every month, once every month, she has to go and check. Okay. Now for the 89th question, calculated MMR. Calculated MMR ratio, 4,000 live birth. So two ectopic, two abortion, two lactocation, two sepsis. This type of question was there. And for this, the correct answer is 250 per lakh. I think this one is the correct answer. Now for the Janani Shishu Suraksha Karyakram, female and infants will be there. JSSK, Janani Shishu Suraksha Karyakram, female and infants, we have to check. Pregnant female and infants. For Plasmodium vivax infection in first trimester, chloroquine or quinine, recommended treatment will be there. Infection first second trimester, recommended treatment is quinine, because some teachers said quinine is the correct answer, but some said, yeah, quinine is the correct answer for this. First referral unit, and we have to tell the incorrect option, and in that one option is there that first referral unit is PHC. That was the incorrect answer. You can check it once, like if you remember that maybe this question is like this or maybe some in different way. I don't remember this question. Now for the 93rd question, some dehydration was there in the child. For that, the color coding is yellow color code is given. Now for the IMR calculation, I for this question also I don't remember the exact question, but I wrote like half. So you can focus group discussion question was there, and in those like options were like open-ended, closed-ended, something like that. So for that, the correct answer is open-ended question. Okay. Now for the forensic, 96 question, man raped woman killed for 3 years ago. Death sentence given by court. Which court has authority? So for this, some teachers said both additional and session court will be the answer, but some teachers said that only the session additional court will give the sentence. So I don't know the correct answer for this question also. Okay. Now for the 97th question, identify dried seminal fluid on handkerchief. Which test best? So for this, the Barbario's test will be the best one. Now for the 98th question, snake bite in emergency, immediate step. So for this, some teachers said reassurance and wash the area will be the correct answer. But some said that we have to immobilize the patient, and some said we have to give the antivenom vaccine. But I don't remember, like I don't know, because I'm also a student. I don't know the correct answer, but I put this question in front of you so that if you know the correct answer, then you can count your mark for this one. Okay. Now for the 98th question, barrel weapon caliber diameter of gun measured by. So that one is for this one, the answer is distance between land and land. For human and animal bone difference, precipitin test will be there. So for this one, the by precipitin test, we can differentiate human and animals blood. Okay. And for this distance between land and land is reassurance the area. Okay. Now for air blast, which organ mostly affected? The correct answer is lung. Lung was mostly affected. Blood during autopsy preserved in sodium fluoride. This one is the correct answer. Other options I didn't remember exactly. So if you know other options also there, then you can count. But for me, right now, for me the correct answer is sodium fluoride. Okay. Two handkerchiefs with blood stains found at crime scene. So how we can preserve those blood stained handkerchief? So for this, teacher said that we have to put them in paper bags. That one is the correct answer. Okay. Now for unknown substance leading LSD, tachycardia and red colored haloid are seen in. So for unknown substance, she took the unknown substance and tachycardia, red colored halos will be seen there. Then the correct answer is LSD. Okay. For MTP punishable, for MTP, which is the punishable. So when the non-entry in MTP registered not sending report to DDHS, that one is the correct answer. Weight of lung name was given. Right now, I don't remember the lungs name of that test, but one question was there. Okay. Now for the pharmacology, mostly questions, if the question asks related to the obs gynos, then I covered that question in obs gyno session. If it is related to pediatric, then I covered it in pediatric. So that's how I covered mostly the pharmacology. But these questions also I wrote it here because I did not these questions I did not cover anywhere. Okay, like drug absolutely contraindicated in female. The correct answer is captopril because AC inhibitor drugs are contraindicated during pregnancy. Treatment for ventricular tachycardia. Correct answer is amiodarone. Least associated effect of amiodarone is gynecomastia. Gyneco Gynecomastia will be there. Now, least associated effect of amiodarone is gynecomastia, and pregnant female mother with asthma and blood pressure was very high. So for her the drug of choice is nifedipine. And about this question, I am not sure that this question will be there or not, but the correct answer for this one is acetazolamide if it was there. Now, for the 110 question, consuming alcohol, vomiting, abdominal pain, chest pain. So for this, the correct answer is cefoperazole. Cefoperazole 111. For treatment of echinococcus, albendazole will be given. For mechanism of action of thiazide, sodium chloride symport inhibition. Mechanism of action of thiazide is sodium chloride symport inhibition in DCT. This one is the correct answer for this. 4.5% bupivacaine, brachial plexus, hypotension, arrhythmia. So for this, the correct answer is 20% intralipid. Drug of choice for malignant glaucoma is the homatropine. For this also, teacher said that this one is the correct answer, but I don't remember this question also. If you remember, then please go ahead and count your 1 mark. Now, for 115 antipsychotic in obese patient, antipsychotic in obese patient. Which antipsychotic we have to give for the obese patient? So the correct answer for that one is the giprasidone. Okay. Hypertension is on hydrochlorothiazide. For this, the correct answer is amiloride. Like female is on hypertension. Which hydrochlorothiazide we have to give? So we have to give amiloride. Okay, because for hypokalemia we have to give. So I did not frame this question correctly, but one question was like this. Okay. Now the next question is DVT and first trimester needs anticoagulant for deep vein thrombosis, and during the first trimester the anticoagulant is enoxaparin. Now for 118 patient is on antipsychotic drug haloperidol and patient develop acute dystonia. For this the correct answer is we have to give benzotropine. For DVT needs anticoagulants that, oh sorry, I like framed this question 2 times, so please forget about it. Acute liver failure result in amanita colloids toxicity. Alcoholic liver disease present with nausea, vomiting, flushing, and hypotension. For this, the correct answer is there is disulfiram-like reaction. Bioavailability of 30% is there. So how we can say that this question was there, and this is the correct answer for this question, that 30% of drug reaches the systemic circulation in unchanged form. Like what do we mean by this statement? Bioavailability of 30%. Now for 123rd question.
So for this, the correct answer was tamoxifen.
Now for 124 question, like the ECG changes noted, use of anti-TB bedaquiline is it increase the QT prolongation. This question was definitely in the paper. Fastest acting laxative like lactulose, bisacodyl, magnesium sulfoxide. Like out of these four options, we have to choose one, but I don't know the correct answer, so I did not write for this. Now for the 126 question, psychiatric patient believe his feeling and thought are influenced by external agency. For this, the answer is delusion of influence. Okay. For 127 question, hospital thinking he has MI as well. He denied to go home as 10 days back. Thieves came there. So for this, the correct answer is acute stress disorder because the patient is highly stressed. Now for dermatology questions, bubo is seen in which condition? So for this, the correct answer is LGV. Now for 129, coral red fluorescence wood lamps will be there, and for this, the correct answer is erythrasma. For nutritional deficiency, chronic alcoholic pruritus, eczematous rash on neck, vitamin B3, uh, vitamin B3 was there, and sorry, vitamin B3 is the correct answer for that question. And flat top, like lichen planus, history was given, and for that the correct answer is topical steroids. We have to give topical steroids to the patient. For multiple lesions with bilateral ulnar nerve thickening, for this the correct answer is bullous impetigo. About this question, like I remember, like this question was there, but bullous impetigo is the correct answer for this question. I did not remember it fully, so that's why I wrote it like this. So next question is condyloma acuminata. So for this, the correct answer is cryotherapy. Painless ulcer with scarring is there. For that, the correct answer is lupus vulgaris because the patient have painless ulcer, but it has scars. That's why the correct answer is lupus vulgaris. For broad-shaped leprosy, which type of leprosy it is? It is borderline tuberculoid leprosy. So from here, like I'm not that much sure because right now I totally forget which question was there about like these questions are there or not. That's why I, though in those questions where I marked here right now, it means, or by with marker, it means that I am also confused in those questions and in their answer also. Okay. Now for the pediatric 136 milestone on transfer of one object to another hand. For this, the correct answer is 6 months because I studied from BTR from Janamam. She mentioned 6 months for this, but during the recall session when I was, some teachers said it's 7 months, but some said it's 6 months. So this question is also in confusion. Now for 137 questions, stranger anxiety appear by age. So stranger anxieties appear by age of 6 months. I don't remember this question was there, but I wrote it. Okay. Now for 138 question, angular cheilitis, stomatitis, glossitis will be there. For this, the correct answer is iboflavin, and I don't know that whether this question was there or not. For 139, Turner syndrome, short stature, widely spaced nipple. For this, the correct genotype is 45X. So, neonate with swelling had seen images was given. The neonate has one swelling was there, and the correct answer for that one is cephal hematoma. For 141 question, which I must missed in an art continuously. That one is dorsal migratory of esophagus from which component of diaphragm? For this, the correct answer is crus of diaphragm. Now for 142 question, again I missed from physio, that is cell membrane uh, change will be maintained by. So cell membrane charge will be maintained by. Some teachers said its answer is Gibbs Donan equation, but I don't know the correct answer for this. So please go with your answer. Okay. For 143, wrong about collagen, something like this mentioned. So for it, type 2 collagen in tendon is not seen. Something like this question was there. So I wrote that question, but I did not frame it very well. Okay. For 144 question, correct method of communication. So for that, the correct answer is only three. Lots of option was there, and from that, only three option was the correct answer. I did not frame this question correctly, but I remember that only three is the correct answer. One for 145 question, MR patient was there. IQ improves. Such survey is. So this one is the positive euthanics. This is one is the correct answer for this question. Right now, I think no one remember the whole question. But if you think that you remembered it, then please mark it according to your question. Now for next question 146, ideal INR value will be, what will be the ideal and INR value? It is 1.5. For 147 question contraindicated for BiPAP, the answer is unconscious patient. For 148 question external beam radiotherapy is given with cobalt 60. For this question, like I'm not so sure because I wrote it again because someone said that these questions were also there, but I did not remember those. That's why I write like this. Blood gas partition coefficient similar to NO is dash fluorine. This one is the correct answer. And one image of ultrasound was given, and in that also fibroadenoma is there. But in OBS gyno also the fibroadenoma histopath image was given. For that also fibroadenoma is the answer. So these were two questions. Okay. So that's all for the revision of first paper. I hope you all